Today, Chicago Mayor Lori Lightfoot said the Chicago Department of Public Health statistics show, quote, 72% of Chicago's deaths have been among Black Chicagoans, though Black Chicagoans make up just 30% of the city's population.
Those numbers take your breath away. When we talk about equity and inclusion, they're not just nice notions. They are an imperative that we must embrace as a city. And we see this even more urgently when we look at these numbers and this disparity. It's unacceptable. No one should think that this is okay.
Joining us now is Chicago Mayor Lori Lightfoot. Mayor Lightfoot, you must have had a feeling that this was what the numbers were going to show, even before the data was assembled, with this overwhelming impact on African Americans in Chicago. Do you have any working theory about why it is?
Well, I think the reporting that you just showed, which is when you have all these health disparities pre-COVID, where you've got a disproportionate number of people in the African American community with diabetes, with heart ailments, with respiratory problems. This disease attacks and feasts on those underlying conditions. And that's what we're seeing manifest in the numbers. I mean, it's breathtaking. When I first saw these numbers, I had a hard time thinking about anything else because I knew that this was going to land like a bomb and that we had to come up with some concrete, rapid responses to help people in these communities.
And there hasn't been any emphasis on this or even a word about it, as far as I know, at the White House briefings, which are the most prominent kind of public transfers of information about this. And yet we heard in the report just now that there has been a lot of misinformation out there. Do you have any sense of what kind of misinformation there has been in the Black community?
Well, I think there's been a misinformation that Black people can't actually get the virus. And the truth is, in Chicago, the first reported death was an African-American woman who then gave it to her sister, who then also died. So the numbers speak for themselves. The fact that Black people are dying at 7 times the rate of any other demographic is stunning. It is a red alarm, an alert that we've got to respond to, and we are in our city.
And Mayor, how do you respond to it in terms of public information? What is the message you want to get to African Americans, and how do you deliver that message both in Chicago and beyond Chicago?
Well, what we've done is we've formed a strike force, and it's going to be hyper-local, targeted outreach to people of color, and particularly Black folks in their neighborhoods. We're going to be calling upon the faith community, elected officials, street outreach workers, people in block clubs to get the word out and then connect people up with services. We've been saying, 60 or over, we're going to lower that to 50 or over in the Black community and really focus on getting people tested, getting them supports, talking to them about what they can do to protect themselves. But we've got to reach more people and quickly.
Mayor, how is the hospital system in Chicago bearing the burden so far?
Well, so far, we're okay. We've been tracking ICU numbers overall, the number of people in ICU beds that are tested positive, the number of people under investigation for coronavirus that are in ICU beds. We've been hovering around 75, 76%. Over the last couple of days, it's dipped down to about 71%. But we know that we are far from out of the woods. We're concerned, of course, like everybody is, about ventilators, PPE, and testing. We are not testing nearly the number of people that we should be. And this is one of the tools that we're going to have to employ in thinking about how we reach Black people. We've got to bring more testing to those neighborhoods so we understand what the underlying data really is. And the last thing I'll say is we've got to make sure that our healthcare providers are providing us with the demographic information. As stark as these numbers are, we know that we're missing 20%, 25% of the demographic information on testing that's positive. So we've got to really ignite the consciousness of our healthcare providers to make sure they give us that demographic information.